Multiple sclerosis is a chronic autoimmune disease of an unknown cause. It is a typical progressive disease involving damage to the sheaths of nerve cells in the brain and spinal cord. Multiple sclerosis can be present as one of 4 clinical types. Relapsing remitting, which is where patients have almost complete recovery between attacks. Primary progressive, which involves a steady progression of symptoms. Secondary progressive, which involves a severe progression of symptoms later in the disease. And progressive relapsing, which involves a steady progression of symptoms with acute relapses. Relapses range from mild to significantly disabling. Damage is increasing with each relapse. The following video will show you more about multiple sclerosis.
Multiple sclerosis, or MS, is a progressive disease of the central nervous system in adults, affecting around 2.5 million people worldwide. MS affects the ability of nerve cells in the brain and spinal cord to communicate with each other effectively. Nerve cells communicate by sending electrical signals down long fibers called axons, which are contained within an insulating substance called myelin. Evidence suggests that MS results from an autoimmune reaction, in which a malfunctioning immune system produces T cells that react with and damage the body's own cells. In MS, an unknown trigger activates helper T cells. This enables the T cells to adhere to and cross over the blood-brain barrier, which normally prohibits the flow of substances into the brain. Antigen-specific receptors on the surface of T cells recognize central nervous system myelin as an antigen. The T cells attack the myelin that surrounds the axons. This causes the central nervous system to lose some of its ability to send signals throughout the body, causing the debilitating symptoms of MS. Almost any neurological symptom can appear with the disease, and often progresses to physical and cognitive disability. Permanent neurological problems often occur, especially as the disease advances. After injury, the central nervous system can repair itself. However, after repeated inflammatory attacks, this repair mechanism can become less successful. Current treatments primarily target the inflammatory elements of the disease and are somewhat effective. Innovative treatments are required that can directly target the central nervous system, not only reducing inflammation, but also inducing repair of the damaged tissue.
The sclerosis of the nervous tissue prevents the transmission of stimuli to the brain and spinal cord and causes the following sensory and motor abnormalities: weakness or numbness in one or more limbs, optic neuritis, loss of vision in one eye, diplopia, unsteady gait, vertigo, difficulty in urine leading to increased urinary tract infections, facial numbness or pain, speech problems, dysphagia, hearing loss, impotence in men, fatigue, emotional disturbances, including depression, irritability, and short-temperedness.
Although the cause of MS is unknown, it is thought to the result from the interaction of genetic and environmental factors. Family history is a risk factor of MS. First-degree relatives of the patients with MS have a 1 to 3% risk of developing the disease. Evidence also show with increasing distance from the equator, suggesting that the decreased sun exposure and low vitamin D levels may increase the risk of developing MS, and also certain infectious diseases and viruses may cause the development of MS.
Multiple sclerosis has no cure. The main treatment goal for a patient with MS is to provide symptomatic relief and reduce complications. Some of the treatments are watching for changes in the respiratory and bladder function, Regulating fluid intake and minimizing bladder irritants such as caffeine will help prevent urinary complications such as UTIs. Taking prescribed pain medications as needed and using things like ice, heat, and massage will also help with pain. Reducing the risk for skin breakdown and alleviating pressure is very important. This can be done by using an air mattress and wheelchair push-ups. The patient should also take their prescribed medications that combat fatigue and the drugs to alleviate spasticity. They should also take their corticosteroids and immunosuppressant drugs to decrease relapse rate. Preventing constipation can be done by increasing fiber and fluid intake and taking prescribed stool softeners. The patient can also see a physical therapist for range of motion exercises, stretching, positioning, and relaxation techniques. They can also see a speech therapist for support with swallowing and speaking. Safety is always key because patients with MS are a high fall risk.
MS varies geographically and is higher in the northern latitudes. Per 100,000 people, the rate of MS is 30 to 70 in parts of Italy and Spain, 100 to 200 in Scandinavia, 100 in the United States, 16 to 30 in the Middle Eastern Arabs, 30 to 38 in Israel, Jews, and 5 to 10 in Asia, Central America, and most of Africa. The disease onsets is typically between the age of 20 and 40 years and peaks at 24 to 30 years of age in most cases. The condition affects women twice as often as men and is diagnosed in whites more often than other racial ethnics. Most common cause of death in patients with multiple sclerosis are pneumonia, pulmonary embolism, aspiration, and pressure sores.
What age were you? 19. Okay. How did you feel when you first got diagnosed?
Kind of depressed, upset to learn that I have this disease. It's not curable.
Okay. So what kind of multiple sclerosis do you have?
Relapsing and remitting.
Okay. And what test did you take when they found out that you had it?
The very first test was an eye test, and it showed I have optic neuritis. And that resulted to MRIs, which showed I had lesions on the brain.
So you did a lot of scans and everything. Okay. Before you found out, what symptoms and signs did you have?
Just the blurry eye, double vision, couldn't see.
A lot of pain?
A little bit.
A little bit? Okay. When you began experiencing these symptoms, how severe were they? Were they like from 1 to a 10 or a 5 or?
Probably 10, constant.
Constantly?
Yeah.
Every day, like all day long, or on and off?
Probably once it started, every day.
Okay. Before you got the medicine, what seemed to improve your symptoms and what worsened them?
With the optic neuritis, the light worsened it because the vision sucked. And to improve it, just with the vision, sunglasses, sitting in the dark, stuff like that.
Okay. And did that get worse over time before you got the medicine?
Yeah, it progressively got worse until I got steroids.
What did you do to manage your symptoms when you first found out?
With MS or optic neuritis?
Both.
The optic neuritis took steroids, the inflammation went down. MS started on medicine.
Okay. What drugs and other treatments did the doctor recommend for you when you got it for MS?
They recommended the shots, which was Rebif 3 times a week, sub-Q, so it went underneath the skin. And they recommended the pill, but my heart rate was too low, so I couldn't take the pill.
Okay. Did the when you experienced with the medicine, did it work for you, or would you rather like did anything else?
The medicine worked for a little bit, but honestly, I just felt worse with the medicine than I do now without taking it.
Without taking it at all, so
Yeah.
you don't take it anymore,
I don't take nothing.
and you
for
feel
8
like
days.
way better
Yeah.
than
I
taking
don't
the
feel
medicine.
sick or tired or anything.
How did you know that it was working when you took the medicine? Like, when you took it, did you feel like, some of the pain and the symptoms that you had before stopped, or did you?
I couldn't really tell it was working at all because, like, when you take the medicine, afterwards you have fever, chills, feel sick. So, like, all the time you just felt crappy every other day because you took the shots 3 times a week. So I couldn't really tell it was working, honestly.
And you said, what was the name of your medicine again?
Rebif.
And that's like it's kind of like insulin, but it's for what, the muscles, or did they explain to you when they gave it to you?
They just told me it was supposed to help slow the progress of the lesions from inflaming.
Okay. Did you have any side effects when you were taking the medicine?
Yeah, fever, chills, felt really sick, body aches, just felt crappy the day after.
Okay, and how would you tell someone who has MS right now to handle the side effects when they take the medicine?
Take it at night before you go to sleep. That way you'll sleep through the sickness and you'll have a better day. If you take it in the morning, your whole day's ruined.
Can you exercise? Can you exercise, or can exercise and physical therapy help the situation better than medicine? In your opinion?
In my opinion, yeah. Exercise is like a good stress reliever, and for MS patients, stress isn't good.
Okay.
And you get healthy.
Okay. And this is a question we wanted to ask. Does MS affect your sexual life anyway, or are you still able to have sex with MS?
Yeah, it doesn't affect that.
Okay. Are there any local support groups around here that you may attend, or that you want somebody else to attend that you would tell them about?
Yeah, there's one in Greensboro. It's the MS chapter for Greensboro.
Okay, and that's in Greensboro? Okay. What would you tell someone else that's going through the same thing for the first time? What would you tell them to do?
I guess just stay positive and don't let it hinder your day-to-day living.
Don't let it get you down, right?
Yeah.
All right, well, Miss Destiny, I really enjoyed talking to you. Oh, does anybody else in your family have MS?
Yeah, my stepdad actually has it.
Okay.
He has the same kind as me.
Oh, really?
Yeah, we're not blood related. We just live together, so it's kind of a coincidence.
So it's kind of have like somebody that has the same thing that you have
Yeah.
that's good to talk to. Okay. All right, well, that's all, sweetie, and I just really thank you for having this interview with me so we can learn more about your situation in MS.
You're welcome.
Okay, thank you.